My name is Dr. Itwa Augustine Iregwe. I'm the current president of CANPAD. With me on my left hand is Professor Kayode Yemito. He is the Dean of School of Basic Medical Sciences, Lagos State University College of Medicine. We go back a long way. And on my right is Dr. Jide Mekanaya. He's a pediatrician and is the president of MANSAG from the UK. And the purpose of CANPAD is to basically find an avenue where Nigerian doctors and as well as allied healthcare professionals can actually collaborate, network, and try to better the life of everybody. So that's what CANPAD is about. We're also involved in advocacy and other activities which I will explain later on. Before COVID, we used to come to Nigeria to do a lot of work in terms of missions. We have a lot of surgeons and physicians who come over to Nigeria to help those underserved areas. Currently, what we are focused on is trying to educate, both the students, that is the undergraduate as well as the postgraduate students of the country. And there are some collaboration which I will elaborate on later on with various institutions in Nigeria, where we provide monthly webinars for undergraduate as well as postgraduate students. So that's our main focus. We also are quite interested in terms of community development too. And I was privileged to be with the newly coronated Alafia for Oyo 2 days ago, where we had a discussion in terms of coming over there to provide healthcare service to his community, LASUCOM. So we signed an MOU with them sometime last year to actually provide that same service for LASUCOM, the students as well. So we're very happy to have that in place. We are currently working on collaboration with the College of Medicine, University of Lagos. We're also working with the Lagos University Teaching Hospital, LUT also. There are also plans to look at Abuja as well as Ahmadu Bello University. So those collaborations are discussions are currently going on. And as soon as those things become reality, I guess we'll let you people know. So we don't really have any particular community per se. So we deal with currently tertiary institutions, like what I mentioned. But like what I said, we met with the Alafia for Oyo just recently. So probably that will be the first community we'll probably go into post-COVID to go in and showcase, our skills there in that particular community. The shaping healthcare policies could be a very, very difficult proposal for a diaspora organization that is not really based in Nigeria, because we're based in Canada. So to shape the policy would be difficult, but it doesn't mean it's not possible. And the reason why I say that is because we currently have a good working relationship with the Federal Ministry of Health. When Dr. Tunji Alausa was the then Minister for State for Health, we had an open-door policy with him, and we discussed ideas with him and all that. And he has also transferred that to the current Minister of State for Health. So we believe that that window of opportunity that we have, we're able to make some proposals in terms of policy, changes. And I know there are some which I cannot discuss openly, which we've had with the minister then, that we can see that actually involved in the healthcare sector. Oh, we have about 2,000 members. 2,000 members in Canada.
So, sir, in Canada?
Yes, in Canada, yeah. I represent Canada.
So now, what is the future plan for Nigeria?
The future plans for Nigeria in terms of Japada or what? Well, in terms of that, so this is Japada you are seeing right now. So there is a complete Japada, there is thank you. There is a partial Japada. So the partial Japada is when you come in and you come in to effect changes in the healthcare sector. Like what AMPA has done currently, where they went to Butemeta, other places to, treat people for free and all that. That is sort of like a mini Japada, so to speak. So CANPAD also is, it is a roadmap we're trying to create to make that a reality. And that is something we're going to go back to when I go back home, to discuss with the members, and they'll try to make that, very effective, in Nigeria in terms of healthcare delivery. So that is in place. The Minister for State for Health, Dr. Tunji Alausa, last year gave a clear roadmap in the UK, which is well versed in terms of what you want the diaspora to do. So we are all buying into that idea of coming back to Nigeria to effect changes in the healthcare sector. They stand to gain a lot. They stand to gain a lot. So I can tell you right now that we have made contacts with a lot of organizations to represent medical students, even in Canada. So they communicate with us, and we also advise them, and some of us are mentors also to them. In addition to that, we also, the webinar series which we are doing is very important for them because it will expose them to, first world medicine. I'm not saying that Nigeria is not doing well, it is doing well, but we'll bring evidence-based medicine to them for them to know exactly what obtains, outside of Nigeria. So that is a stepping stone. Gradually, the plan we have is that we're going to come down to Nigeria, our members, we go to various institutions, identify them. If it's to lecture students for 1 week, for 2 weeks, we work with LASUCOM, work with LUTS, work with CMUL, other institutions. People are willing to come down to Nigeria to educate the medical students, to inspire them. So that is something we're going to work on, and I believe that the students will be inspired by those sort of avenues that will open to them. I cannot speak for everybody. Everybody, we're all different in terms of what you want to do, your future goals, what you want to achieve and all that. But I can tell you that the core of everybody is a love for Nigeria. We all love Nigeria. We all want to see something happen, want to see change happen. So I believe that for those of us in Canada, we are looking for burning for an avenue where we can come in, an unfettered pathway where there is no roadblock, so we can come in and show our skills to the country and then can leave also seamlessly. So there is hope for the Nigerian doctors there because they are passionate about this country. And for the Nigerian doctors here too, I think they're also passionate about their country too. And I do not blame them, they want to go overseas, because you have to understand that as a doctor, you always want to strive for the best. You want to make sure you work with the best. And if the best is not here yet, then you look for where it is. And if it is in Western world, you go there like I did, like he did, okay? He did a lot of postgraduate stuff overseas also, all right? And then you come back home to try and, give back what the country has given to you. I think the government is really doing a good job, right? In terms of, I'll just, go back to what I said about the Minister for State for Health, then who is the current Minister for Education, Dr. Tunde Alausa, the passion he has, and also Professor Mohamed Pate also, the passion they have for changing the healthcare sector is unparalleled. We are in the diaspora, and we see things from a 360-degree view, and we can see that they are passionate about improving things. But remember, the system has been like this for many years, decades. It's going to take a long time for the changes which they are doing will, come to fruition. But we are with them, we support their ideals, and we are all working as an organization, collaborating to ensure that the vision, the goals that they have, is achieved, in Nigeria.
Yeah, the role LASUCOM is playing is to make sure that we achieve the goal which CANPAD is bringing to Nigeria. We're very excited when he approached, or CANPAD approached us some few years ago, that they would like to have a good collaboration with institutions in Nigeria, and particularly LASUCOM. LASUCOM, that's Lagos State University College of Medicine. We are a sister organization with LASUT, that's the teaching hospital. We are planning to have a form of webinars, which they have started already. We are keen into that so that our students that are the boarding doctors will also benefit from that. Let me say, first of all, that we know that the most important are human beings. Even the CANPAD we are talking about, they are still Nigerians. The only difference is that they have relocated to where things probably work better than here. Work better not because this place cannot work better, but because they have better equipment, better instruments, better materials to work with than this place. It's still Nigerian brains that are doing this thing. So what they are doing for us, and which we appreciate, is to let even the students that are still in school to understand the fact that whatever you have here might not be good enough, but you are still the human capital. You have the brain to develop yourself, and they are there to let them know that whatever you are being taught with here is not the Eldorado. There are better things abroad, and which they are also willing to bring home if the situation is good enough to warrant that. They are willing to do also in form of education, in form of research, in terms of collaboration, even partnership, for them to visit and come back once in a while and all that. So we are very receptive, because we know that we are probably we are going to be the beneficiary of whatever good ideas that they have, that they want to impart on our students. So we are very willing and we are very cooperative with them. Whatever they are bringing, we are willing to accept whatever they are bringing to us, so that everybody will benefit from it. I'm sure it's a good thing in their own mind that they have been able to acquire some better information and to come back home and impart that knowledge. That is a very good thing for them. So the best that we can do is to be receptive to whatever they are bringing to us. And of course, the human capital development is here, so they too can also benefit from it. Like I said, Nigerians are one of the most intelligent people all over the world. Everybody knows. So that's why even the CANPAD and the UK counterpart, it's still the Nigerians that are still in those places. The only difference is just the environment to work. So our own is just to be receptive, and whenever they are willing to come and help us, we are willing to take them. So that's what the best that we can do.
There will always be challenges to anything new. Anything new that someone is doing, there will be challenges in terms of, there could be a change in administration, there could be a change in personnel, there could be a change in the vision of, say, CANPAD or the institutions we're collaborating with and all that. But what we believe is as a change will be for better, not for worse. So there'll be no degrading of the efforts that we're going to put into such an initiative. And again, we have to talk about a succession plan. So when you leave office, you hand over to the next person to say, okay, this is what we are doing, this is how far we've gone. Nobody will deliberately come in and try to, sort of cancel, a program like this. So we believe that, this is something that will be from generation to generation, and hopefully we'll get better with time in terms of the area of collaborations that we're going to have with the various institutions.
So I'm Jide Menakaya. I'm a pediatrician. I trained in Benin and then went to England and Australia to train to care for newborn babies. And that's what I do for a living. And I'm currently the president of MANSAG, Medical Association of Nigerians across Great Britain. And I look after 15,000 doctors, the wealth of 15,000 doctors in UK, and about 2,000 pharmacists and allied healthcare professionals. We also have a nursing group, but they're a different organization. I think from what my colleague Dr. Itua has talked about, I think there continues to be challenges in terms of engaging with the diaspora and the Nigerian healthcare sector. And I think in taking on the role, one of the things we looked at was look exactly at the mechanisms of why that's been a challenge. And so what we've come up with, working with Dr. Salako, who is now the current Health Minister for State, is to develop a program we call SCALE. And SCALE stands for Strengthening Collaboration and Advancing Clinical Excellence. And what that does is really to bring in the postgraduate training boards of our where we work in the UK, link them with the faculties that train doctors in Nigeria. So you're linking professionals with professionals such that the Nigerian system, our Nigerian colleagues like Professor here, will be able to say, this is what we want to do for the Nigerian setting. I think someone asked about sustainability. So it's not for me from the UK to say, I think you want to do this. No, it's about the professors here saying, this is what we want to do, and what we from the UK can do is to say, we'll work with you to develop that. So that is what scale is about, and that is what Dr. Salako, reading on from Dr. Lausa, is saying. Now, how do we do that? I think that the diaspora community is one global community. We've got Nigeria, 200 million people, okay, at the very most, 100,000 doctors, or if not 20,000 doctors. So really, we should leverage all of us together doing the same thing. So here we are talking about, going to, Oyo to do something in the community. So there is no point, UK people coming and doing something different. Why don't you latch on to what they are doing and doing exactly the same thing, or multiplying it across all the geographical zones? They've got the expertise, so there is no point in me bringing something else. I can work with them to do that. And so the point is to bring together all the global diaspora community in one voice doing that thing. So the work they are doing with medical students, I'm not going to reinvent the wheel. I'm going to say to each one, that thing with medical students, well, let's do it together. I'm going to Maiduguri to do it now. So do the same thing, set up the same platforms, and do the same thing. So that's where we are going with the collaboration you're talking about. The second thing is what we call the STAR program, skills again about sustainability, skills transfer and retention. So this afternoon I was at Luth. We're talking with Luth to say, we are Nigerian doctors and healthcare professionals. We want to help. What can you do? And Luth said, we want you to help us with your care of the elderly service, with our care of the elderly service. We want to set it up. So I was there today to look at how we can make it happen. So we can train doctors, we can visit, we can train, we can support, we can enable exchange programs to make sure that we transfer that skill not only on a one-off but on a continuum basis, so that we can train our doctors, we can give them access in the UK. And actually, one of the things is that for those of us in the UK, we are determined, we are passionate about coming to Nigeria. So it's a win-win basically. So really what we want to do at the end of the Care of the Elderly program, we now have the deliverable is we do have that opportunity to say we've trained XYZ doctors, nurses, therapists and all that. It's not just we've come down, but we've got within the service a deliverable that we are delivering that, and that we've monitored and evaluated. And that's the reason why, that's the thing we are thinking of doing, and again, working across all the diaspora communities.
I think over the next 10 years, what we hope is that there will be an improvement in the sort of collaborations we have with other organizations in Nigeria. I think that is what he's passionate about, and he's also passionate about that. So look at tertiary institutions. UCH is also one of our targets also, as well as communities that we'll have to reach out to bring back skills from Canada, back to Canada. And one of the presenters here talked about sustainability. So it's not just missions now, but actually having infrastructure in place, training individuals, allied healthcare professionals, so that skill, stays with them for quite a while. So this is just the beginning. So we believe that in the next 10 years to be a different ball game, definitely. Funding is definitely a challenge. I think one of the speakers mentioned today, was it $450,000 over the last 2 years or so spent on missions or something like that. But the fund is not going to come from Nigeria. It's going to come from those of us overseas. We raise funds. We have CANPAD Foundation, where people make donations and all that. We also have organizations that are pledged to CANPAD. We have partners. So all we have to do is to tell them we're going to Nigeria somewhere to do something, and they will provide funds for us. So by the time you convert it to Naira, we believe that we're able to, do something quite reasonable that is sustainable. The way we work there is that we do not believe in half measures. When you go out to do something, you make sure you do it and you do it well. And there'll be plans also in place to ensure that year in, year out, there is maintenance, there is review, there is audit being done. So I think in terms of, sustainability, I think we are capable of doing that, as long as we work with our partners and have a good understanding in terms of what is expected from both parties.
So just to take on that point as well, I think that we have to be creative around funding. I think that there is that opportunity to engage our local partners, our local economy, to be able to support this work. So I was at Lut today, and I saw that there was a cancer building that was donated by somebody. There were lots of things being done locally by business people, philanthropists and things. So I think about the funding from outside the country. So it's got to be two-way in terms of making it happen, because the grants are usually one-offs, and we're talking about sustainability. So there has to be continuing engagement with local economy to make it happen.
Okay, maybe I too can say something. So
Please, go ahead.
Our intention is not just to be the ones that will just be receiving. We too are eager to also contribute to this. It's not only to be receptive to it, but also situations, conditions which might help the partnership. We are also going to provide that. For example, as little as you want to do this program, we have big hall for you to use. We are not going to be asking you to pay for that. We are going to give you this. Whatever we too have in this environment, we'll provide it for them so that they too will be willing to do more. So I'm sure that's what we too are willing to do. I just use that as an example. We are open to anything that we too have opportunities to give. We'll also do it in this regard.
Sorry, I would like to